Health is one of the biggest aspects of life that people take for granted. When I was 9, I was diagnosed with hypothyroidism and Hashimoto's disease. From that point on, my struggle with my health began. Due to these diseases, I struggled with anemia, fatigue, intestinal issues, and more. I'm from New Jersey, and unfortunately, private insurance was extremely expensive. In the United States at the time, my medication cost almost $1,000 for 30 pills. My mom has a lot of experience in the medical field, and she is the main reason that I was able to have access to the healthcare that I needed when I was sick because she would know what to do. As someone who was born and raised in the United States and whose primary language is English, I can barely understand the healthcare system in the US. But I believe in a world where everybody could have the ability to get the healthcare they need, not just by availability, but by accessibility. I am here ready to fight for our basic human right to healthcare, and I am here because I believe that we all have the right to live healthy lives. Porque merecemos vivir.
Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health is the most shocking and inhumane." In 2017 alone, over 40,500 people were held daily in ICE detention centers. And in that same year, 36 death reports were recorded, but only 18 were released. Of those 18, 7 were analyzed to have substandard medical care as a contributing factor to death. Let me paint you a picture. This is the life that these people are living. They sleep on floors, they have the clothes that they have on their backs, and they're packed in cages like sardines in a can. This is a breeding ground for germs. This is a breeding ground for sickness. This is a breeding ground for people to get sick, which is exactly what happened to Jose Azurdia. Jose Azurdia was a 50-year-old man who struggled with respiratory issues while being detained. 3 weeks after getting to the Adelanto detention facility, he complained of having chest pains, nausea, and headaches. And when asking for help and seeking the treatment that he needed, he was denied. Why? Because the nurse said she did not want to see Azurdia because she did not want to get sick. I can imagine Jose Azurdia as my father, as someone who needs help, as someone who needs treatment, and is being denied access to that treatment. Unfortunately, 4 days later, Jose Azurdia passed away. The contributing factor was the substandard medical care he received at this detention facility. Healthcare is a fundamental human right, and yet, over 8 million people die annually due to a lack of access to quality healthcare. While the US has had some solutions to combat this, like the Emergency Medical Treatment and Labor Act, which allows for treatments in emergencies regardless of insurance status or documentation status, there's a big gap. There's not enough funding. And also, there's community health centers, which offer low cost treatments to people from lower income communities. It has the same problem. There's not enough funding. So, my proposal is a cross organizational collaboration, which will allow for a checks and balances system to be in place to make sure every party upholds the role they need to uphold. This would include community health centers, advocacy organizations, educational institutions, immigration attorneys, and immigration and customs enforcement. You may be wondering where we'll get the funding for this. In 2024 alone, ICE will receive $25 billion in funding. Part of that funding can go towards ensuring community health centers have the staff that they need in order to be a part of this partnership. Attorneys will ensure that their clients will sign waivers so that they can advocate and fight for their clients in cases of their clients not getting the treatment that they need, like Jose Azurdia. There will be an incentive for medical students, which would be their clinical and residency hours that they need to graduate. This would then make them work for community health centers, and that way we can make sure that community health centers are properly staffed and medical students can graduate with their hours. The Debt Relief Fund for Health Equity is an advocacy organization that is meant to fund other advocacy organizations that are fighting for health equity. There would be some requirements that would need to be fulfilled in order to get the money needed for this proposal, but that is something that could be worked with. And last but not least is the Public Service Loan Forgiveness Program, which would be an incentive for physicians and nurses to work in the public health sector. To work in the public health sector. And this proposal is not the solution to the problem. It's not the end all be all solution, but it is a step in the right direction. So today, I want to leave you with one question. If access to healthcare is considered a human right, then who is human enough to have that right? Thank you.